Hello, my name is Jenny Dorich. I'm both excited and humbled to be nominated to serve on the American Society for Hand Therapy's board as a board member at large. I am a CHT practicing in hand therapy. I began my career as a hand therapist practicing in a freestanding adult clinic for 5 years. Then I transitioned to working at a pediatric academic medical center at Cincinnati Children's Medical Center, where I've practiced the last 21 years. In addition to having a diverse caseload of children and young adults with upper extremity impairment, I'm a clinical researcher. I obtained a PhD in rehab sciences in the latter half of my career, and I lead a portfolio of research focused on outcomes assessment and hand therapy practice for pediatric patients, as well as evaluating the effectiveness of hand therapy intervention for pediatric hand conditions. It was during my pursuit into research that I became more involved with ASHT. I attended a research division meeting at the 2017 annual meeting and saw the opportunity to become more involved and contribute to ASHT and the hand therapy profession. In this journey, I was unexpectedly invited to apply for the chair-elect position of the research division. Now, a few years later, I am in the final months of serving on the ASHT board as chair of the research division for the past 2 years. Through these experiences, my knowledge of how ASHT supports the profession of hand therapy has expanded, and I have been able to take on an active role in contributing to a positive future of the profession in my involvement on the board. I've enjoyed the opportunity to meet hand therapists and ASHT members while volunteering within ASHT. I like learning ways that ASHT members wish to see the organization support the hand therapy profession and working with the board and ASHT strategic planning to align everyone towards positive outcomes for our profession. I see myself as a servant leader. I want to serve our profession and my hand therapy colleagues as a board member at large. In doing so, my approach is to first seek understanding, applying my inquisitive nature as a researcher to gain perspective from ASHT members, and then using this understanding to represent member perspectives and guiding the work of the board. One of the initiatives that I have had an instrumental role in during my time on the board as the research division director is spearheading the first pediatric hand specialty day at the 2024 annual conference. I was hearing from a large constituency of hand therapists about an unmet need for more pediatric-focused contents and offering within ASHT. I brought this concern to the board and worked with the board and ASHT staff to make it happen. I want to be an instrument in continuing to impact the profession of hand therapy in additional ways. With increased focus on diversity, equity, and inclusion, I see opportunities for increased inclusiveness and membership, as well as active engagement of all members throughout ASHT to positively impact the hand therapy profession and ultimately the patients we serve.